Everyone. I'd like to just first extend a thank you to Dr. Susie Soliman. Thank you so much for coming in. We're very happy and grateful to have you here. So this will be an easy meeting, it'll be about an hour just for everybody that's involved. We want to leave kind of like the last 10 or 15 minutes for Q's and A's. I'm sure lots of people here have their own personal questions that they want to get answered. Hopefully, some of the questions that we have already might answer some of them. But Susie, or Dr. Solomon, I'm sorry, we'd love to know a little bit more about you, your background, maybe what got you into. I know that you're a pharmacist, nutrition, supplements, and what's your favorite thing about your field?
Thank you. Thanks so much for having me, Lena. Nice to meet you as well. And thanks also to Tony for having me to record this today. But my background is I'm a pharmacist. I went to pharmacy school and then I did a residency and fellowship, and I worked as a dean at the University of Illinois for quite some time, and I was faculty there. Then I worked in the pharma industry, and along the course of my education and training, and even working in my clinic that I worked in cardio. I saw a lot of times that someone would start a medication, take a medication, and then all of a sudden you would need another medication and then another medication. And it just kind of spiraled into a lot more than what it should have been. So let's say, for example, you just start out with just knee pain, and then you have this knee pain, then all of a sudden you get all 10 other side effects from taking Advil. Let's just start simple, or Tylenol, and then you have 10 new side effects. And then all of a sudden you're like, wait, I need to take this other medication to take it to prevent an ulcer. So it was like all these other things. So for me, I just became very passionate about why does one medication cause you to take multiple medication, and really the importance of preventative medicine and just the prevention and staying healthy and looking at longevity and long-term strength and all of those factors as well. So I just really kind of gained a true interest in that, and supplements, vitamins, and where we were lacking, rather than just, if you're feeling down or depressed, maybe you just have low vitamin D, and maybe you don't need to go start 3 medications for your depression. So it's really looking at that as well. So it was just my passion. I can't talk more about it. I encountered it, I saw it firsthand, and I saw patients debilitated from medications as a pharmacist. And it was more my passion to help people get off their medications and just use natural medications, which is really just exercise, things like that.
Wow, that's so incredible. I know that I see that day in and day out with people on multiple medications and not knowing how to come off because they don't really know the impact of medications and what it does to their body. So that's, and like you said, it's something as simple as Advil or Tylenol can really impact somebody's life. Yeah, so we'll get in straight to the question. So you were talking about preventative medicine and exercise and saying that somebody might feel depressed and they might start on antidepressants when they're really just lacking in their vitamin or mineral deficiencies. So my first question comes to you as how can specific vitamins and minerals enhance, our day-to-day lives or athletic performance, and how can it support muscle recovery for those that are engaging in physical exercise? I know a lot of the people that are in this group really like to focus on their fitness and health. So a lot of my questions today will also be kind of geared towards them as well.
Definitely. I think, so you bring up great points. And I think for really just maintaining our own nutrition, vitamin D comes to mind. So vitamin D is important for bone strength and helps, prevent sports related injuries. So if you are working out and you want your muscles to have adequate rest and all of that, but you still want to make sure your vitamin D levels are on point and definitely even above average. And I would say that especially if you live in an area in the northern hemisphere, that you need to check your vitamin D every year. You want to make sure that it's accurate and correct. There are other things as well. Vitamin C, if your levels are not good, you might have post-workout soreness, and vitamin C can actually decrease that post-workout soreness and kind of protect your muscles from injury or trauma. So again, taking in potentially even just fruits with vitamin C might help that. Magnesium is another one that stores our energy, and it's the body's main storage form of energy, and it's really key to that. So supplementing with magnesium can help improve your aerobic performance. So somebody who is struggling aerobically. So, I mean, myself included, I am definitely, I don't have a lot of endurance. So I think, you know, magnesium is something to look at. So there's really specific supplements in sports nutrition that can help. And then if you're looking at weight or weight management, there are other vitamins that can help, you know, to with weight management. And sometimes our vitamin measures are low, and it actually is, that's the reason why we're struggling with weight. And it might not be other reasons as well. And there's different, you know, supplements that can help as well for weight loss, and especially if they're low. Now, if your levels are normal, it's not going to do much, but it is specifically when they are low.
Uh, can we actually delve a little bit deeper into that? So what would those look like? And you're saying that also, so sorry, this is two questions in one. So you mentioned, you know, getting your levels checked every year. So you think that somebody should, a normal person like you and I should go get our levels checked once a year then?
Yeah, definitely vitamin D. I would say you should get that checked. I think at any age, I check my children's vitamin D to make sure that their vitamin D is accurate, you know, where it should be as well. So I think that's critical, is getting that checked. Yeah, no matter your age, and you know, no matter where you live, even if you live in Florida, I would say, you know, you do want to check it. Or if you're in California, I think you still want to check your vitamin D to ensure that it is where it should be, because a lot of times that is what's causing us to have some of these problems.
And then specifically for those that are struggling with weight management, where would like typical deficiencies lie that would may impact their ability to lose weight or to regulate their weight?
Definitely. So there's quite a few areas actually that could impact your weight. So it could be just vitamin K. So if you have poor vitamin K status, that can cause excess fat tissue. Or vitamin K also helps metabolize our sugars in our body. Asparagine, which is typically found again in like asparagus, you think of, but it's an amino acid that actually increases our insulin sensitivity. So if you have better insulin sensitivity, it will help your body store the energy in muscle instead of storing it as fat. Vitamin E, it inhibits your pre-fat cells from changing to like mature fat cells. So that's another good one. Vitamin B5, or a lot of the vitamin Bs. There's actually one study that linked vitamin B5 to less hunger when dieting. So taking that in is also important. So there's quite a few vitamins that you can look into. There is testing for vitamins as well. Not all physicians' offices will do it, but certain ones do, especially if you're interested in seeing somebody who specifically focuses in that area. But those are some big ones that are important. Another one is chromium, and I always personally recommend chromium to almost everybody, because I think chromium is so important because it really does increase our insulin sensitivity. So it will help reduce our body fat. And a lot of times when I have patients who are pre-diabetic or who have a lot of excess abdominal fat, I recommend a chromium supplement right away. That's my first thing I recommend to help with that. Um, because it can definitely impact the lean muscle in all of your insulin sensitivity. Um, Zinc is another one. So if you're deficient in zinc, a lot of times you feel really hungry, and zinc supplementation can reduce your appetite. Just so that might be another one. And that might be lower in certain patients. That is just lower in general.
Wow, that is some golden nuggets of information for sure. Yeah, who knew that just from either getting yourself tested or just adding a few supplements to your diet that it can really make such a huge impact. Um, thank you for that. So kind of on the same spectrum as that, we hear all the time, Dr. Soliman, about protein and protein supplements and meal replacements. So my question to you lies, how does taking animal or versus plant-based protein supplements affect the body differently, for those who choose to use it? Or, you know, should we be using it at all, or is it okay to use one as a meal replacement? So I'd love to hear your thoughts on this.
Okay. So in terms of meal replacements, personally, I'm not a big fan. I know that if you have a very busy lifestyle and they're more convenient and they're quick and they're easy and you have, a very busy schedule on the go, I think they're useful and it's better than binge eating or going for something that's less healthy. But I do feel that they're not all created equally. So some of them have great nutrients and great fiber, and some of them have no fiber, and some of them have a lot of bad ingredients that you should avoid in general as well, that might actually make you feel worse or not feel as good. So you really want to select a high quality meal replacement if you're going to look at it, making sure there's at least minimum 20 grams of protein if it's even worth it. And you want to look at like how many added sugars and make sure there's fiber in there and all of that. I definitely would never rely solely on, meal replacements or shakes or anything like that, because I do think that having whole, real food whenever possible is critical. And I think that's important. Going back to the other question too, in terms of animal versus plant protein and what's better, I think some of us have a taste, right? So some of us prefer plant protein in general. That's just what we prefer. But some plant proteins are incomplete proteins, so they don't have all the essential amino acids. So you can have a little bit more. I would say that both animal and plant proteins can be helpful in, providing a healthy diet. But I do think animal protein has a slight edge if you're looking to build muscle to complete the whole amino acid profile and make everything better. But plant protein is definitely an option, and it's there. And I think, it's better than no protein, right? And I know personally, I prefer plant protein. I'm not a big meat eater, and I have to kind of force myself to eat meat. So that was something that I had to grow in, but I have, my kids or my husband that prefer, they don't want to have plant protein at all. So I think it is like a palate and what you're interested in as well. But the animal protein in general is easier to digest and absorb in your body a lot of times as well.
And as a general consensus, would the average person need a protein supplement in their diet, do you think?
I would say the average person, no. If you're not looking to build all this muscle and you're not looking to be a bodybuilder, then no, I would say that you don't need that. I think if you eat healthy and you maintain, you're eating what you need to eat each day. So you're not binging, you don't have candy all over your desk, and you're eating healthy. I don't think you need supplements. I think really what we need is real food. And unfortunately, in this country, we don't have real food. You go to the grocery store, even things that are real aren't real. So you really have to look into what you're eating, what you're putting into your body, and reminding yourself. And all of these sicknesses happen because we're putting a lot of toxins in our body throughout the day, throughout the week, and then we develop all these other symptoms. So people who are suffering, for example, from reflux, you might have reflux, and it's because all the food you're taking in is not real food. So if you're putting things in your body, you're going to get this. And all of a sudden, if you just switch and you just start eating real food, like I have patients who are like, well, I have to have chips and I have to have French fries. Then I'm like, okay, well, just have a potato. Cut the potato. Even if you put the potato, in oil and you fry it at home, it's still better than, what you're going to go eat somewhere else. So a lot of it is we're busy. We live in America. We are super busy people. I'm up at 5, I go to bed so late. It's like we're constantly busy, constantly on the go. So we don't have the time to cook and to prepare, but those people who do, it does make a difference in your body. You can tell when someone cares about what's going into their body, and you have to love. I think a lot of times goes back to loving yourself, right? So, loving yourself includes, and taking care of yourself includes what goes into your body, right? So taking care of ourselves means what we put into our body matters, and not. So sometimes, a lot of times people associate negative emotions, like I'm feeling bad about myself, I had a bad day, such and such broke up with me, or we had, I'm fighting with so and so, and then all of a sudden you're binge eating and you're not eating real food. So, it goes back to taking care of yourself and remembering what you put into your body matters. And if it doesn't matter now, it's going to matter 30, 40 years from now when you're potentially, getting a chronic disease.
Absolutely. It's definitely cyclical, I believe.
Yeah.
Um, and I guess a lot of people say that they don't know how good they feel until they start feeling better. And it's about breaking that cycle. And it's the easy thing to be convenient, but it's not the convenient thing to have, those whole nutritious foods in our diet, especially if you're as busy as you are, or those who work multiple jobs, and of course in America, like the economy doesn't allow always for those whole foods. So just to piggyback off that, what do you think is maybe the easiest way to start incorporating um things that are maybe not convenient, but to start incorporating whole foods into our diets?
I would say you start small. So if first of all, if you're not doing anything, you need to change your life because you cannot eat, fast food or just microwave meals all the time. You got to really focus on it. So I would say start small. So even if it's just one meal a day, meal prepping is useful for those people who are busy. You can prepare all your meals on a couple times a week and you have everything ready to go if you're able to do that. Some people don't like to do that, but I think starting off with just having, fruits on your countertop. So that's what you're going to grab, or vegetables, incorporating vegetables. And really what's important is mixing it up. So it's not about having one apple every single day. You want to have a variety of fruits and vegetables. So you want to have an apple and you want to have an orange and you want to have 5 greens. And I always tell my patients, make sure you do X, Y, and Z per day. So what 3 fruits are you going to have today? What 3 vegetables are you going to have today? Then you can put everything else in. But first, tell me what 3 vegetables you're going to have each day. And if you don't have 3 vegetables, then you're doing it wrong. If you can't name the 3 vegetables you're going to have that day, I actually say this to my kids too. I'm like, what vegetables are you going to have today? What fruits are you going to have today? And then you have to plan your day around that. Then everything else will come in. Like then you can pick your meat and all of that. But um, I think that's really important to just start with that. Like what fruit and vegetable did you have? And if you go a day without having either one, then you had a bad day, right?
Wow, that's actually really good advice. I think I'll probably start doing. It's almost like putting a star on your chart. Like, okay, I have to
Yeah,
check off the list.
exactly. Yeah, like I did it, I checked the box of what my body needs, and that's what our body needs. I mean, that's really what we needed originally before we started putting all these toxins in our bodies.
Yeah, that's awesome. Okay, so we'll kind of switch gears here a little bit, if that's okay with you. We're gonna probably go into now medications.
Mhm.
Um, I know that there's some medications that can impact workouts. Should we have any considerations for or should someone have considerations for when working out while taking medications? Like, is there things that they should or shouldn't be doing, or what medications might affect maybe somebody's health or impact their health over time?
Definitely. I think there are certain medications that can impact while you're working out. And then there's medications that can even cause weight gain. So I can even start there. So a lot of times we're on certain medications and we're prescribed them and we need them. I'm not saying medications, we don't need sometimes we need to take a medication, but there are certain antidepressants, for example, that can cause increased appetite or can cause sedation or and make it harder to burn calories and make it harder to lose weight. So if you are taking medication, I guess my message is that what medications are you taking? Does this impact your weight gain, your fat redistribution? Does it impact your ability to sleep? How does it impact your ability to potentially gain weight? And looking at that and how you can change it. Maybe you want to discuss your weight concerns with your physician or your prescriber and adjust your medication. And I think that's really important. So a lot of people take medications, for example, to fall asleep. And I start with this and I always tell everyone, don't take Benadryl to fall asleep. Don't take ZQuil. Don't take any of that stuff because number one, it's linked to dementia. So right now it might be helping you to sleep, but it is one of the there's a lot of clinical data to support that anticholinergics can be linked to dementia. So that's probably not the safest thing you want to take to fall asleep. There are a lot of other natural, healthier ways to focus on sleep than that. And then also it makes you more tired. So you might not want to work out. You might not want to go to the gym at 5 a.m. or 6 a.m. to go do your workout. And it also can impact your abilities to gain weight and all of that. So I think you need to look at what medications you're taking and how it can impact your body, because a lot of them can impact your body, and you don't want to take things that can impact your ability to gain weight if you're trying to lose weight or you're trying to stay healthy. So I think that I'll start with there. There are specific medications too that impact, muscle building as well. So and there are certain medications like beta blockers, right? They're prescribed for heart conditions or high blood pressure, but they can actually interfere with your adrenaline in your body during exercise, which can limit your muscle growth. Statins, they're used to lower your cholesterol, and sometimes, on rare occasions, they can cause muscle pain and all of that. But sometimes they can make it difficult to exercise effectively for muscle building. A lot of men use Propecia because they're losing their hair, and that really can impact your ability to gain muscle. It can also cause gynecomastia or enlargement of breasts in the male. So that can impact the way you're looking. So I had one patient, he was working out 3 hours a day at the gym. No joke, 3 hours a day, running 8 to 10 miles per day, doing weights, everything, could not build any muscle. I mean, if you looked at him, you would be like, he was okay. He was fit, but he wasn't as fit as he should have been. And it was because he was on Propecia, but he had great hair. So, I mean, his hair looked great. He looked like he was 16 with all the hair he had. But I think, you need to look at what medications you're taking and then what the benefits. And he was upset because he was like, my body's not where it is. And he was eating properly. Everything, his nutrition was great. Everything was great, but his body was not where it needed to be. And it was because of the medication. So, I think, again, that's important to know what medications can impact your ability to build muscle, and that a lot of medications impact your ability to build muscle.
Wow. Again, some more golden nuggets over here. All the things I never knew about. I'd like to kind of circle back to sleep and more natural remedies to sleep. I'd like to delve a little bit deeper into that. Now, I know a lot of people take like melatonin, or they'll drink like chamomile tea to go to bed. Do you think that there is one specific thing that maybe people can take to help them fall asleep better? Or do you think that we should naturally maybe try to wake up earlier and exercise to go to sleep? Is there something that is like standard across the board in your opinion, or is it kind of idealized for everyone? It's individual.
So I think it's definitely individualized. I think that every person and the reason why they can't sleep, it could be you could be going through a tough time. You could have a sick family member. You could be sick. You could have something happening in your life that's traumatic, or have an issue. So I think that's definitely an issue. I think it is individualized. I want to say that one medication or supplement that I think is that's very helpful as magnesium glycinate. So I recommend, if you can't sleep, you should take magnesium. I'm not a fan of melatonin. I do not recommend it typically, but I do recommend magnesium glycinate. So if you're having trouble sleeping, you're probably deficient in magnesium. I do recommend therapy. Now, not traditional therapy in the sense, not necessarily that kind, but really looking at the traumas. I don't know if everyone in here is Arabic, but if you are, I think that a lot of times we were told to hush a lot of our traumas in our childhood. So I think that addressing them, looking at them, facing them, and kind of either crying through them, living through them can help. So I think that a lot of times it could be stress related to our own trauma that is having that. But yeah, eventually sleep hygiene is important. So not being on our phones 24/7, or scrolling before bed because something might alert you or upset you, that can impact your sleep as well. So I think there are quite a few things that can impact your sleep. I do think it's individualized because based on if you're premenopause, postmenopause for women, that makes a difference as well. For men, all of the hormones make a difference in our sleep. So I think that's important too. I saw a question that came in and I just want to address it. Benadryl for allergic reactions is fine. I actually think it's the best thing on the market. I would recommend if you're having an allergic reaction, if you just got stung by a bee, Benadryl is the best thing out there on the market. It's temporary and it's short term, but taking Benadryl every single night to fall asleep is completely different. So I would never, ever recommend that to anyone to take it for falling asleep at all, just because of the data that shows the link to dementia. And I don't know how many of you read the book Outlive, but I'm a big fan of Peter Attia's book. And so, the four horsemen, and one of the horsemen that we could die from is, right, dementia is how we will go. So preventing dementia and having brain health. So brain health is important. I love to talk about brain health because it's not just about our muscles and our body. We need to keep our brain healthy as well. And what are things we can do to keep our brain healthy? And that's avoiding some of these medications as well.
Awesome. Awesome. I've actually seen, now that you mentioned brain health, supplements that help support focus and brain health. Are those just placebo, or are there actually things that help support our brain?
So I actually work on a supplement personally, so which is called Nariva, and there is some clinical data behind Nariva. It is a brain health supplement that helps with memory, focus, and it has neurofactor in it and phosphodiesterone. They're two molecules that can help. I think though, brain health, the most important thing is just, again, sleep hygiene, not being on your phone a lot or on getting in touch with nature, touching the earth every day, exercise. Listen, if you are going to have the most important medication ever in the history of humanity, it is walking. Nothing will beat walking. So if you can walk or exercise, there's no medicine on earth that you will take that will beat that. I have patients who will say, I was just diagnosed with high blood pressure. I'm like, well, did you try yoga? Did you try working out? No. But a lot of times in this culture, people would rather pop a pill than go to the gym, right? But who likes going to the gym? I mean, I saw a video of Ronaldo the other day. He was like, everyone wants to be Ronaldo, but really to be Ronaldo, you have to go to the gym every day, right? You have to go. And he's like, I don't like going to the gym every day. I mean, even Ronaldo doesn't like going to the gym every day. Nobody likes going to the gym, but you have to make a decision. Do you want to take that medication or do you want to just go to the gym? And it's really your choice. It's your life, it's your choice. So looking at that and what's important to you, I would say you should choose exercise every single time because it's going to make you feel better. It's going to help your brain health. It's going to help your whole body. There's nothing like exercise, in the world.
Oh, I absolutely agree with you. That is so impactful. Just having a healthy diet and exercise really can help prevent, I want to say, almost like 90% of the diseases that I see on a daily basis in the hospital.
Yeah.
Absolutely.
Yeah.
And you can't talk about going to the gym and fitness without really talking about nutrition. Every influencer out there will tell you you can't out train a bad diet.
You can.
Um, and like you said, the guy can be in the gym for 3 hours and there's something wrong inside. So he doesn't see the results on the outside. That being said, that actually is a perfect lead up into my next question. For those that are fitness focused, like all of our friends in this call, that are looking to optimize their nutrition, what are key factors that they should consider when choosing supplements if they choose to add them into their daily routine?
So I think you want to select, the main thing is with a supplement is to select one that doesn't have toxins in it because you don't want to go and select one and then all of a sudden you're taking something that makes you sicker than what it should. So some vitamins and supplements have lead. Some of them have mercury. Some of them have talc, like the talc powder. So you need to check the ingredients and make sure that none of that is in there. Some of them have artificial or natural. They'll say natural flavors. Anything that says natural flavors, it might consist of like high fructose corn syrup or hydrolyzed vegetable protein. all of those are flavor enhancers, right? And they put them into the supplements and vitamins to make them taste a little bit better. A lot of times they're added into children's vitamins to enhance the taste and just make them more enjoyable, but they really have been associated with development of diabetes, hypertension, increases in body weight. So all of a sudden you're taking something, you're gaining weight. So you want to make sure what you're taking is clean. Another one is titanium dioxide. It's been banned everywhere in the world except in the US. If you know about Skittles and you saw all the data on Skittles, because there's titanium dioxide in there. But that's linked to stomach cancer, autoimmune disorders, organ toxicity, and it can cause allergies and a whole bunch of stuff. And sometimes they use it as a filler. And a lot of times, most people who are allergic to a medication aren't allergic to that specific medication. They're actually allergic to the fillers in the medication. I mean, you probably see this too. So as the nurse, they put all these fillers in these medications. And so someone will say, well, I'm allergic to this generic by this manufacturer, but I'm not allergic to that one. And because of the fillers that are in there. So there are certain things in there that we do not want to have, even just cause they might cause inflammation in our gut. So when selecting them, you need to look at not just the active ingredients. So if a product says, I have so many drugs on my desk, but like if something says like vitamin B on the front, then all of a sudden you look on the back and there's like 12 other inactive ingredients that are just fillers. You don't want to take that.
So speaking of toxins and fillers and things that we don't want in our body, is there one thing that comes to mind that you absolutely stay away from or that you avoid?
Yeah, I mean, personally, I would say titanium dioxide is a big one in
Okay, that's
supplements.
a big
So if
one.
your supplement says titanium dioxide, don't take it,
Toss it
right?
out.
Like, I mean,
Good.
it's a long name and it's difficult, but I personally would avoid that. All of the dyes, if you can avoid dye at all, I would try to avoid dyes. I personally love Twizzlers, so that's a very difficult one for me because but trying to eat, more natural foods is important. Again, we look at everywhere else in the world and they don't have all of these toxins except here they're killing us with a lot of our food.
So basically look up what's banned in the rest of the world, and then if it's in your
Yes.
food.
Yes. Exactly. It's like it's everywhere else. And then and then you have people who are like, well, I'm still trying to lose weight and I can't lose weight. And I'm like, well, we need to look at all these other things because if you're looking for that perfect figure, if you're all, into fitness, then you got to start, looking a lot closer as well.
All right. So I asked you what comes to mind for something to avoid, but my next question will lead me into the opposite. So if you had one piece of advice that you would give to someone who just began their wellness journey, what comes to mind?
So just beginning, I would say don't give up, right? I think that it's long and it's a long process and it's depending upon where you are in your life, you might be living with family members who are not on board, who are still eating like matluba every day and they're not like, like they're just not on board and they want a lot of food and all of a sudden you're just having, chicken and or steak and some salad and or it could be your spouse, or it could be whoever you're with. So I think, starting out and sticking to it, that initially it might be difficult, whether it's exercise, whether it's changing your eating, all of those in the beginning are very difficult for people. And it could be cultural, right? Like you get together with your family and everyone is like making these big meals and having, drinks and everything that we probably shouldn't be having. So I think sticking to it and thinking about, for me, I always think about, I recommend to patients thinking about later, how do you want to end your life, right? So we don't have control of what diseases we're going to get. But we do have control that we know some diseases are linked to diet and to obesity. So if you're able to prevent that by trying to stay fit, then why wouldn't you do that, right? Like, why would you keep drinking, Coke every day for dinner? I think, if it's not good for you, then why are you doing that? Obviously, certain diseases we can't prevent and we don't know, but there are a lot that are linked to diet and exercise. So, and I think the other thing is just exercise. I mean, if you can get outside and get outside every day, you need to get outside, even if it's cold. I tell people go outside. If you're feeling down, If you're feeling depressed, get outside. Stop what you're doing and just go outside. No matter what you're doing, stop what you're doing. If you feel down, if you feel depressed, go outside and you will feel better. So reconnecting with nature, is so important.
Yeah, absolutely. I remember when I was first starting out, I started really getting interested in getting my health together about 10 years ago. I felt so lost. And I didn't know where to start. Luckily we have, a lot of online communities now that help each other and support each other in health and fitness goals. But do you have any resources for people that, just need really good information that, if they have questions that they can go to?
Um, I think so personally, I like to read. So some of the books, I love the book Outlive, and I'm going to keep talking about it because he's actually Egyptian too. I don't know if you guys are familiar with him, but
I'll have to order it. Yeah.
yeah, it's great. And it talks about, not spending the last few years in a nursing home or, sick, and how to ensure that or not guarantee, but that what we can do. So just um, things like that. I think I go online. I love Facebook groups. I love actually what your group is offering, because I think that's important too, because you need accountability. You need friends. You need to know that you're not alone on this journey, because a lot of times we can feel alone. I think that's, critical as well. And knowing that you have other people who are there to support you is important as well. And I think just really don't overwhelm yourself. If you're starting out, just start with something small, an achievable goal. It could be, I'm going to walk 10 minutes a day. It could be, I want to run a 5K. It could be very, very small. It doesn't have to be, I'm going to be a marathon. I'll never run a marathon. I can tell you right now. I would never, I think I would be dead if I had to run a marathon, but maybe it's on my 10-year plan. But right now I can barely run a 5K. So, I think you have to start small. You have to start somewhere, and you have to do what you like and what you enjoy. And then you can, increase the difficulty, increase the duration, all of that helps, but I love having, a workout partner. For me, I always recommend that to people. So I love going into the gym with my friends. That's like my me time. And then we just talk and we catch up. And for me, it's like I'm accountable, and I'm there with my girlfriends, and, then we'll sit together, and we might go get like coffee or tea after the gym too. So things like that. I just feel like that really does help.
Yeah, that's great. Wow, this has been such a good session. I would really love to open it up uh to the call and see if anybody has any questions. What do you think, Tony?
Yes, thank you so much, Dr. Susie. And we have we have about 11 people in the room. Open discussion. Does anyone have a question for Dr. Susie? Yeah, if you have a question for Dr. Susie, just unmute yourself, go on camera if you like. Dr. Susie, a question from me just to get the Q&A started. What does your current training program look like? Are you into strength training? Are you like a cardio queen? What does your current program look like?
All right. So I am a big believer in strength, because cardio, I feel like, is important, but cardio is not attached to longevity as much as strength is. So we need our strength as we get older. We need to be able to carry our groceries in the house. We need to be able to still open up a can, and right now, if you're young, you're not thinking about that, but post, as you age, it's critical to be able to do that. So strength is important. For me, I do strength training 4 days a week. So that's for me the biggest thing. I do still do cardio. I think that I don't know how advanced you guys are, but I'm very big into zone 2 cardio. So if you don't know much about zone 2, I think that's where you should be, and where you should be spending the majority of your cardio. I still think you can go up to zone 5 as well, and I think that's important, but zone 2 is where you should look into focusing, at least initially, and that's important and linked to longevity. Balance training is important. So if you're not doing anything for your balance, the younger you start, the better. So I look into, balance, and training. I wish I started that younger. I am not that great at that, but you know, because as we age, you don't want to have a fall. How many of you had a grandparent or somebody who fell, a loved one who fell and got hurt, and many times they die after that, right? They don't recover. So fall risk is a big one, and so I do think balance is important in terms of longevity and lifespan as well.
Thank you, doctor. We have a question in the chat from Nora. Nora asks, I did blood work. Everything came out normal. I started working out, but I still feel fatigued. Any idea of what it could be?
So it depends on your blood work and what came back normal. So it could have been just your regular blood count and your liver and all your enzymes and everything was normal, and that's correct. But a lot of times it could be something else that is causing the fatigue. So it could be that you're potentially not sleeping right. Your vitamin D could be low. I don't know if they checked your vitamin D or not, but if your vitamin D is low, you're going to feel fatigue permanently until you do that. And initially, okay, it's 38. That's very low still. That's super low. I would say above 50. So you're still low. With a 38, you're going to feel fatigued. So that's too low. Yeah, if it was 20 before. Okay. So I see why you're tired. I would be tired too. I'm tired seeing the number 38. That makes me tired. So definitely you'd want to have a vitamin D at least 50. I don't know your age, but I would say definitely 50. So that's partially why you feel fatigued, but continue working out. Working out will give you more energy regardless. So even if your vitamin D is low, you need to continue working out. That is definitely a way to have more energy, is to work out. There's, again, number one thing. Good. You're at the gym right now. Good job. So that is the number one thing to do to improve your energy, to improve the way you feel, is exercise. And again, it doesn't have to be all cardio. I really stress strength training. The younger you are, the better. And you know, cardio is great too. I think cardio is great, but I think that we all need strength. I'm a big believer in strength training. Vitamin B12, does that affect fatigue as well? Definitely. So vitamin B12 can impact your fatigue. Vitamin B12, I actually just did a post on this on Instagram the other day. And it can impact, like, even if you have, like, some people have like cuts on the corner of their jaw, vitamin B12 can impact so many things. And if you take metformin, which a lot of people do, if you're pre-diabetic or if you're pre-menopause or if you're just looking to lose weight, if you're looking to live longer, it can cause a deficiency in our vitamin B12. And vitamin B12 is a significant cause of fatigue and tiredness. So I think that, you know, it's important because it carries the oxygen throughout our body. So having a low vitamin B12 can impact our body. It can cause potentially anemia and can make us feel extremely tired. All right, let me see. There's a bunch of questions now. Yeah, fatigue could be low iron, B12. Yeah, do you want to read these, Lena? I'm like looking.
Yeah, no problem. Yeah, I'll kind of direct. So Nora also asks, what are your thoughts on lipotropic?
You know, I think, okay, they lack a strong scientific evidence for, if you're using them for weight loss, right? I'm assuming that's what you would use them for. You can tell me if you're using it for something else. I'm not necessarily a huge fan. Maybe they can boost your, you know, your energy levels, but I'm a big believer in natural. I think our bodies can do this. Our ancestors did this all naturally. So I really believe that we could do this naturally. I'm not a big person in who believes in a lot of newer things. So I don't know if I would probably personally shy away from something like that. Does timing your supplement make a difference? Yes, it does, 100%. I did a post on this. If you want, you can DM me. I have a whole post that I did on this, on what time of the day and what you mix your supplements with. It really does impact. So certain supplements you should take in the morning, like B vitamins, you should take in the morning because they give you energy. So if you pop B vitamins right before bed, you're going to have trouble sleeping because, you know, you probably don't need that burst, you know, at 8 p.m. or 10 p.m. So you really want to look at what time you're taking it. Magnesium, you should probably take at night because it's going to make you drowsy. So it is important to look at the timing of when you take the supplements.
That's, yeah, those are great questions. I actually had a question for you, if you don't mind.
Yes.
There's a lot of this like kind of new thing is the IV infusions, and specifically I wanted to ask you about NAD, and if you had any thoughts about how effective it is.
Okay, so for vitamin infusions, I know people do them, and they don't necessarily work any better than if you were taking a regular supplement, in your stomach. There are a lot of physicians who do them. They are a big money maker. So just to be transparent with you. So patients will pay and people do them. I have a lot of colleagues. I work in a clinic where we do them. Do I get them? No. To answer, I don't. There is a risk of anytime you get an IV put in, you're at risk of an infection. So maybe I'm just overly cautious, but I just feel like if you can take them, orally. Yeah, I kind of agree with Nora because she's saying she gets them for free, but she's scared of IVs. I'm not like, I don't see there is a benefit, I guess, potentially, but I think that you can just, if you're deficient, you can correct it through oral supplements. If it is difficult to correct it, so for example, vitamin B12, sometimes it is difficult to use an oral supplement, then you might need to get an injection, not necessarily IV, but you might need the injection to improve it. So if you're not seeing improvement with your oral supplement, then I definitely would say I would go to our IV vitamins. But if you have supplemented it and you're seeing a benefit, then probably you should be okay. I think there's a lot of growing interest in NAD supplements. The safety and effectiveness is not 100%. I think though, you can look into it. I would look into it. It's, again, checking. There are ways to check your vitamins naturally. So you can just go get a blood test and check and see. So even women who suffer with hair loss. So I have so many women that are like, I take biotin for my hair. And I'm always like, don't take biotin for your hair. If your biotin's not low, you're just taking biotin and you're wasting your money. Like biotin doesn't help hair loss, right? So you should take things that will actually work, like rosemary oil or something that would work if your vitamin levels are normal. So same thing with NAD. Like I would check. There's definitely benefit. There's a lot more studies and like research that needs to be done, but there is data to support it. So, but I would look into it further. I would look into it more.
Perfect. I think we have one last question. It was privately messaged to me. And I think we'll wrap it up after that. It says, what are your thoughts on chromium, and what is your favorite overall supplement or brand that you trust? And I'm guessing that you're avoiding gummy vitamins.
Yeah, I do avoid gummy vitamins because what's interesting, when you make a gummy vitamin, they can't even put as much vitamin in it that you would in a regular vitamin. But if you can't swallow it, I have one of my sons, I don't even want to say his age because it'll give away who he is, but he still can't swallow a pill. So I'm always like, I just buy him gummy, like vitamin D. I'm like, fine, just take the gummy because he won't swallow a pill of a vitamin D. So if you have to, and it's the only way you're going to take the supplement, then that's okay. But definitely I try to avoid it and I don't give them to my kids. I try to avoid that. In terms of my brand or supplements, I look for all clean ones. So I just make sure that those specific ingredients that I had mentioned are not in there. I don't necessarily advocate for one specific brand. I work with different brands, but I don't necessarily say like this one is the best. And I would say every single time, look on the back, check it. And if there's not 30 things in there, then that's probably the best one. I love chromium. That, I think a lot of people are deficient in chromium and need chromium. And if you're pre-diabetic, if you have family members who have diabetes, if you're somebody who has a lot of abdominal adiposity or a lot of abdominal fat, you carry a lot of fat in your abdomen, I would say that. How many of you guys, if you have one of those scales, the new scales that say like your visceral fat and all of that. So if you are carrying visceral fat, I recommend chromium. you know, right away. If you have any visceral fat, I would recommend chromium for you. And that's a big one.
Wow, that has been amazing. Thank you for answering all of our questions. We really appreciate it. Guys, drop Dr. Susan Soliman a follow on Instagram at Dr. Suzanne Soliman. I think that's all the time that we have for now. Do you have any last words for us, doctor?
No, thank you so much for taking the time to talk to me. I appreciate it. And if anyone has questions, yeah, you can message me. I have some of my favorite brands, I think on my link tree probably, but if not, like you can ask me questions and I can send you stuff.
Yeah, we really appreciate your time and taking, we're so grateful that we have somebody who's so knowledgeable. I feel like I learned so much from you, and I really appreciate you coming out and talking to us. It's really nice to have somebody who's from the family. So thank you so much. I'm sure everybody here appreciated it too.
Thank you. Thanks so much. I appreciate it.
All
Bye,
right.
everybody.
Thank you, doctor. Goodbye.
Thanks, honey. Okay, bye-bye.
Bye-bye.